We are a bunch of biological systems that are continuously intercommunicating. These sort of mystery symptoms that I refer to as evolving autoimmunity. These are things that they arise from within, if you like. And the answer wasn't in any kind of medical intervention. It was about these early warning signs. If you look at those 8 things and then slowly making some changes.
You mentioned that work is full on. You are, right in the trenches as an NHS GP. Why don't you tell us a little bit about that? Because there's a lot in the press in the UK. There's a lot of perceptions that people have on the outside. But kind of what is it really like at the moment, would you say?
Yeah, it's a really good question. And I'm very aware that people get sick of people moaning all the time. And GPs often come across as a group that complain about how hard life is and how hard we work. And of course, on the surface, we're very well paid and, it's a job like any other. I think what's happened in the last year and a half, because of COVID-19, because of lockdowns, because of the way that we've been forced to work in some ways, the amount of activity that comes through to an NHS GP is so much more than it was even a year prior to that. And it's like a hamster wheel. The more work you do, the more work comes in. It never goes the other way. It's never quiet. And the perception, I think, because it's, we're the closest to patients in some ways. We're not in a hospital environment.
Yeah.
It's really difficult to see the risks because it looks. I remember there was a doctor that used to work for us whose husband has a hospital job, and just could not understand how she was always late home from the practice, and said to her, how hard can it be? It's just a list of names on a screen. Completely missing the point that one of those names next to it might have tried to commit suicide yesterday, been seen by mental health referred back to the GP, will only speak to Dr. X. That's one of about 80 or 90 calls, not calls because you might have to bring them in, obviously, but problems that you have to solve.
In one day.
In one day. And that is a challenge, and my colleagues and I think we do the best job that we can. But even with the most superhuman skills, there's a limit to how much you can do. So it's, and what we see has changed as well. I mean, mental health, I've never seen so much mental health need in my whole career. And other things, these sort of mystery symptoms that have been grumbling along that people put up with, which we can talk about. I mean, I refer to it as evolving autoimmunity, but just sort of people who aren't feeling right, but you can't quite put your finger on it. And of course, the medical model doesn't always work for that because we kind of think, well, can't really find anything, sent you for loads of tests, everything's normal, carry on, And so there's a lot more of that. I think everyone's just had such a hard time. So,
I mean, 2 things that really stand out there for me are, of course, the intense and potentially unmanageable workload, really, let's be honest. Right? It's the NHS has relied for years on people going above and beyond the call of duty, but it does seem to have ramped up massively. Regarding patients and what you're seeing, a couple of interesting things that you said. One is that you have never seen this level of mental health problems coming in. You've been a doctor for what, 25 years now? Is that?
Not quite. Oh, it's a long time, but 23, knocking on 23, I think. Yeah.
Okay, so over 20 years.
Yeah.
I think these unexplained symptoms and evolving autoimmunity we should talk about as well. But let's just talk about mental health problems. What do you mean you've never seen it this bad? Paint a picture for us.
So not just in terms of stats where you've got, 1 million people waiting for mental health treatment, but so it's not a statistical thing necessarily, but just in terms of the qualitative nature of why people ring up. So if they may ring up with something physical, And if you know, like myself, I think I'm fairly compassionate, and I listen, and I take the patient seriously, and I want to help them. That allows them a bit more space to say, and actually, I'm really sorry, but I'm just not coping. And a patient that I might have known for 10 years, who is quite resilient, in inverted commas, is suddenly on the edge. And as a doctor, I'm sort of thinking, whoa, if they're struggling, then that's that sort of thing where you think, you play your friend at tennis and he's like, oh, my arm's injured, and actually he can't serve, and you think, oh, actually his arm really must be injured because he's not serving. He'd normally beat me 6-love, whatever. And it's the same with that. A lot of my calibration is on people I've known for quite a while, and the ones that normally quite resilient are not. They're struggling. So that's at the sort of milder end, I'd say. But then at the other end, in terms of, there's not a day that goes by on Twitter now where there's a post about someone who committed suicide and no one knew. I'm sure you see them as well. Yeah. A lot of them are NHS staff, unfortunately. Really, really sad and horrific in a way. And, for someone to get to that point where they no longer want to be here, I mean, we've got to look at ways of making that a kind of never event. And the problem is that the gap that there is now, I think, in terms of the amount of need and how many people are out there that can help is too big a void. We need another solution. I don't know what that is, but I just know what we're doing at the moment is the tip of the iceberg.
Yeah, I mean, I think it's a massive problem.
Yeah, it is. And I think the difficulty is the tools that we've always had to deal with whatever mental health issue it is, whether it's anxiety, depression, or just well-being, which is, I guess, sort of proactive. A lot of those things just aren't working, I think, because of the environment, because of restrictions, but not just that. We're, in terms of well-being, for example, what makes well-being? So, digressing a bit, but on my podcast, there's an episode on well-being, and I think people who tuned into it were expecting me to talk about diet and exercise and movement. And actually, what I start with is about environment. If you are in a toxic environment, say, forgetting COVID for now, but if you are in a toxic relationship, or your home environment is not good, or your working environment is toxic, it doesn't matter whether you've got the healthiest diet in the world or you run across the South Downs every day, you will not have good well-being, because, do you know what I mean? It's at a base level. And I think the problem is all of us are in a terrible environment at the moment, because we're all going through these incredible, I don't want to use the word unprecedented, but I've just used it, unprecedented times where our freedoms have been affected. Things that you take for granted, like seeing your family or just going to the shops or getting on public transport, suddenly are much harder to do. And we've been ground down. It's been a long haul.
Yeah, it really has. And this kind of pressure is literally creating a cauldron of bubbling mental health problems. Some will blow up now, some will blow up in years or in months, but it's still going on. I mean, would you agree with that, or do you have a slightly different perspective?
No, I do agree with it. And I think the difficulty and why it's so hard to get a handle on it is that you use the word bubbling up, and in terms of language, that's exactly right. And my sort of way of putting that is that all of those things happen in slow motion, whereas COVID is very acute, and these numbers are very acute. It's like, look, there were X number of infections and X number of deaths, which are horrific stats, so the deaths, every single one kind of affects you, doesn't it, when you look at those numbers? But what's going on here doesn't happen acutely until it does. The suicide, for example, which is an acute, awful event, is the end of the line of this kind of slow motion, kind of this indolent thing that's going on that you can't really measure and you can't really see, but slowly but surely a lot of lives are sort of falling apart, and I think that's what makes it so difficult. You kind of need to be aware of, if there was some sort of magical early warning system, like symptoms, which there are for certain conditions, obviously, but, then we'd be able to kind of take stock of them and possibly do something. But that doesn't sort of exist in medicine. It's not something that we're used to doing, that true kind of prevention.
In terms of practical tools, and I know full well, just like you, that every case is different, right? So we can't necessarily say for anxiety, do this, for depression, do this. So, you know, there are some kind of common things that we know work, but, you know, we're very aligned in how we look at patients. It's very individual. It's very personalized to that individual's life and their triggers. But in terms of sharing some sort of practical bits of wisdom, what are some of your kind of go-to tips, I guess, when people are struggling with their mental health?
Yeah, if we're thinking about mental health, firstly, I totally agree with you. It's whatever it is, whether it's mental health or physical health, it's all connected, isn't it? The whole thing is just connected up. We are a bunch of biological systems that are continuously intercommunicating, and when they start to malfunction, you start to get symptoms, you know, and this is what I meant, you know, I'll come back to mental health in a second, but when I was talking about evolving autoimmunity, it's one of those, you know, how people joke about everything falling apart at 40, and that's not normally what they mean by that is, I don't know what's going on, doctor, you know, I don't feel right, you know, can't digest my food, my joints ache a bit, I'm getting these headaches in the morning, my wife thinks I'm depressed, and increasingly I realise, because that happens to a lot of people, they're all interconnected. That is, those symptoms are a sign of systemic malfunction. There's something not working correctly for them to get all of these inflammatory symptoms, whatever they might be. And mental health in some ways is no different. I think the difficulty is that we've, you know, and if you look at, you know, what you and I teach on our course, the symptom web, for example, which are the 8 kind of factors that give rise to anyone's health at any one point when it comes to non-communicable disease. So we're not talking about the acute stuff. Non-communicable disease is something that you don't catch from someone else. So we're not talking about COVID-19, for example, but potentially long COVID, which is, you know, something that is established, would fit into this framework, or joint pains, or feeling depressed, or having heartburn. You know, these are things that they arise from within, if you like. They're not things that you've caught from someone else.
Or I guess autoimmune disease.
Autoimmune disease would fit well into that. And as you know, the factors that we look at are, you know, stress, sleep, diet, movement, historical infections, which I'll come back to, your environment, which you've already talked about, your genes, and then sunlight, which is a sort of a euphemism for vitamin D, but sunlight probably better, to be honest. And actually, if you look at those 8 things, and you know, one of the things I've had to do this on myself, and I'm sure you have. I've had to do this several times, and I do it quite often if I'm not feeling right. Something will pop out, you know, and I can tell you that, you know, my health pretty much collapsed when I was 40, and it took me about 6 months to work out why, and it was using this kind of framework in my head, and I'll tell you what it was for me. So my daughter wasn't sleeping for about 3 years, and every night we'd be up almost all night. I had a lot of stress at work. I had a complaint that wasn't really anything to do with me in the end, but it was horrific, and my stress levels were through the roof. And the other thing is that many years ago, historical infections, I had something called dengue fever, and I was in hospital for 2 weeks, very, very ill.
You were about 18, 19 then, is that right? Travelling?
That's right, yeah. with my mates Vic and Alex. And anyway, I was very, very poorly. But you forget about these things once you recover. But actually, historical infections, things like glandular fever, for example, they leave a stamp on your immune system. And you'll see that people that, you know, go on to suffer symptoms like fatigue often have that kind of story in their background. So those 3 things in my symptom web, the historical infection of dengue fever, no sleep for 2 or 3 years, I say no sleep, but very little sleep, and very high levels of stress were enough to totally upset my system. And overnight, I literally couldn't think. I remember going into Costa Coffee next to my surgery and not being able to order. I always have the same thing as well, which is a black Americano. And, you know, I was staring at this thing thinking, my brain's just not working. And, you know, my neck was aching. I couldn't literally, overnight, it was almost like my memory wasn't working. My joints weren't working. I was getting terrible bloating after me. I turned into one of these patients, you know.
Yeah.
And the answer wasn't in any kind of medical intervention. It was about making adjustments and changing things in my lifestyle. I know people get annoyed with that phrase, but in my life, I guess. Yeah. So, and what was going on there, for the people who kind of thinking, well, what was wrong with you? And a lot of my friends were like, oh, maybe you're depressed, or trying to sort of stick a label on it, going, well, maybe you just imagined it all, that whole. I'm like, no, I definitely didn't imagine it, and I suspect it was that evolving autoimmunity. It was system malfunction where nothing was working. My gut, my brain, everything was sort of off kilter. Yeah. And all the things that you talk about on your podcast and in your books, and that I'm going to be talking about in my book, which will come out next year, is really about how you put that right. And the framework for that is something that you and I teach. And it's one of those things I wish everyone kind of knew about, because it works.
I mean, we'll definitely get to the course, because lots of people have been asking me for us to talk about it a bit more. The course that we teach doctors and other healthcare professionals. But I think your story is fascinating, and I think many people listening or watching this will resonate with that. And this phrase of evolving autoimmunity, I think, needs a bit of unpacking, because there's this kind of thinking in medicine, isn't there, that certainly the way we've been taught, and the way much of it is practice, is it's very black and white. You either fit into the disease category or you don't. So, for example, let's take something that many people have heard of, type 2 diabetes. Okay, when your blood sugar hits a certain mark, let's say on a type of blood test called an HbA1c, let's say at 6.5, for example, we say you have type 2 diabetes. And 6 to 6.5 is pre-diabetes. So you can go get your blood checked, and if it comes back at 5.9 or 5.7, right, that is often reported as normal. And I think this is a great way for people to understand it. It's like, well, it may be normal, but is it optimal? Is it optimal for you, right? Maybe your optimal was an HbA1c of 5, and maybe it's progressively been going up, and now you're at 5.7, but potentially if you do nothing, in 3 years, that may have crept into the pre-diabetic range or the type 2 diabetes range. And we often discharge people like that. I say we, the profession. And there's many reasons for that. I think it is training. I think it's also the way the system's set up, but that's called normal, right? That is not normal. An HbA1c at 5.9, categorically, to me, it is very rare that is ever a normal result, yet it gets reported as normal. So it's this idea that by the time you get a diagnosis of type 2 diabetes, things were probably starting to go wrong for 5, maybe 10 years, right? We know, let's say Alzheimer's. By the time you get a diagnosis of Alzheimer's disease, that process started at least 30 years ago in your brain. And actually, I think that's where medicine will evolve too. We'll start to pick up these things much earlier on. And I think autoimmunity also fits into that bucket, where by the time you get the diagnosis of, let's take what my dad had, right, lupus, he didn't just wake up one morning with lupus. No, there were signals and triggers going into his body for for many, many years. Some I've touched on before. I've written a lot about this in my next book, about what happened to dads. But this was a relatively, with hindsight, a predictable event, that this was always going to happen. And I really feel we have to reframe things for the public, for the profession, in terms of how we look at these things. You either have the disease or you don't. And as you say, maybe had you done nothing at 40, you might have been sitting here now with an autoimmune disease, with a label and a diagnosis. Do you ever think about that?
I do. And listening to you say that, I totally agree with you. This sort of idea that you wake up one day with celiac disease or lupus or any it's never like that, is it? There's something going on, in your immune system way before that. But actually listening to you say that, I sometimes what I do, I sort of think, let me just listen to this as though I was the doctor I was before I knew all this. And a lot of medics will be thinking, well, what do you do then if you do find that it's going to happen? What do you just get them on steroids early on or what? And the difficulty, I think, is that the interventions that seem very soft, like, for example, singing, because it sort of activates your vagus nerve, for example, and the vagus is important for stress management, anxiety. It also, years ago, I made a short film down in Kent about COPD, chronic obstructive pulmonary disease, and how actually it improves your lung capacity. These are all patients with established disease by singing, and they were in a choir. It was wonderful. But I think the thing is, there is data on this stuff, but it's not because it's not a drug, or it's not a kind of intervention that is going to have grade 1 evidence. It seems a lot of singing is probably a bad example, but maybe dietary changes or exercise or sleep, for example, we kind of know they're important. And the thing that I think you and I try very hard to do is everyone sort of knows that those things work, but it's doing it that's quite difficult, and fitting it into your life. And I think we very much understand that, and you've got to start with where the person's at to make sure that they can just do something. You can't do all of it overnight. It's very difficult. Some people do. I remember a friend of mine, who shall remain nameless, he bought a stop smoking book, very, very popular, probably the best stop smoking book of all time, and had read the whole thing in like 40 minutes, and then rang me up and went, "I'm still smoking." And I'm like, "You just tried too hard, just slow down," And the problem is, a lot of people have that attitude towards health. And I think this sort of early warning, these early warning signs, it's about taking note of them and then slowly making some changes to see if they help, And also, there's an inevitability in medicine. I think some medics that I know would be like, "Well, you're going to get it anyway. I mean, what's the point?" There's that sort of attitude, which I don't buy.
Well, if you get in early enough, and even when you have crossed let's say the threshold, often you can turn it around, right? Yeah. Often it isn't, you're in the disease club now, you have to stay there. It's just not true. I wasn't taught this at medical school, but I had to go out, learn it, like you, with our own interest. And, I'm delighted that we have put it together for people in our course Prescribing Lifestyle Medicine. What's your take on the course? Because, it's hard for us to talk about it like this, but look, the feedback is just incredible. We've had, maybe over 2,000 people now do the course. Feedback is incredible. I think 95% of people say they're highly satisfied. Over 90%, I think, have said it has significantly changed the way they practice. And we're talking about initially, GPs. Many hospital specialists have come. I know there's been a psychiatrist, endocrinologists, cardiologists, and now we're sort of expanding out. I know I'm incredibly proud of the course. Tell me about it from your perspective.
Yeah, I mean, it was a bit of a. I remember when we first did it in 2017. We didn't really know what to expect, and then we got this amazing kind of reception because there was clearly this gap that you and I had kind of known about for a while, and other people had been sort of feeling it. And then as soon as that first course went out, we thought, wow, there's definitely something in this, because people are coming back with so many success stories and just, me too, I'm extremely proud of it. We've sort of revamped it somewhat, haven't we? And it's been updated, and it's been kind of put online, because obviously we used to do it face to face.
We love doing it face to face. 3-4 times a year we do it face to face, maybe 200-250 people there. We could talk to them, we could interact with them. That was great. And I hope we can do something like that again soon. But we have converted it online. And we can now have people from anywhere in the world doing it, which is fantastic,
which is amazing. And I mean, it's the same content, isn't it? You still get exactly what you would get.
Just taking a very quick break from the conversation. If you are a healthcare professional anywhere in the world and you want to do the Prescribing Lifestyle Medicine course that Dr. Panja and I have just been discussing, all you have to do is go to prescribinglifestylemedicine.org. You will learn a very simple but a very, very effective framework that you can use with your patients and your clients You'll get a diploma from the European Lifestyle Medicine Organization, prescribinglifestylemedicine.org. There's also the web link in the description box below. Now back to the conversation.
And I think what, just going back to what you were saying about type 2 diabetes, so nowadays it's very common parlance in the world of medicine and well-being and the public that low carbohydrate diets are helpful in type 2 diabetes. And I think you do a diabetes case on the course, you know, and it's a really, really brilliant moment for me because A, you approach it from a different angle, and B, you realise that the case that you picked was a guy who was already on a low-carb diet and it wasn't working.
Yeah.
And suddenly, going back to, you know, the symptom web, you realise that there was other things going on in his routine that were driving his blood glucose up. It wasn't to do with what he was eating.
Actually, he was so focused on his diet that in itself was becoming stressful, and that stress was actually driving his blood sugar. And you see this a lot, right? And I'm always trying to stand back and look at the big picture.
Yeah.
When we think of lifestyle, food is something that gets a lot of attention for good reason. Food is a very, very important factor, but it is not the only one, and it's not always the lever that needs turning. But I'm always thinking about lifestyle with my patients, right? I'm always thinking about what is it in their lifestyle, in their environment, in their past history, in their childhood experiences that may be contributing to the person that I'm seeing in front of me today. And then when you look at that, there's always a whole range of different ways that you can approach it. And, you know, I've tried various methods over the years, and I feel I don't always get it right first time, but I kind of feel I get a really good feel now of what is the key lever to turn that by default will correct another 3 or 4 things straight away. So instead of trying 4 or 5 different things, what is the one thing I can turn? So let's say sleep, for example. People who are struggling with blood sugar, whether that is for type 2 diabetes or for something else, and many people have blood sugar ups and downs. Yes, the diet helps. I'm not saying it doesn't, but I think a lot of people don't realize that, you know, sleep deprivation will drive your blood sugar up. Being stressed, you know, your blood sugar going up is a perfectly normal response to stress, right? It helps you in that acute situation to mobilize energy and do what you need to do to get out of that stressful situation. But if that acute stress becomes chronic stress, if it's we're talking about the state of the world at the moment, right? If you're experiencing this low-grade chronic day-to-day stress, well, for some people, that is why your blood sugar is elevated. And I think that's what we do really well in the course is bring the big picture to people. And I've got to be honest, I think it is rather unique what we teach. I guess it's not really a course, right? It's we teach people a framework on how they can apply it. And I think that's why clinicians really, really love it. Because it's not just hearing, oh, I could do this. We're like, you could do a million things, right? Here's, as you mentioned, the symptom web. And then we've created something called a personal framework where people can it actually spits out the lifestyle prescription for you. And, you know, it took us months to kind of come up with that. There's a real deceptive simplicity to it. But I think that's because people can learn, they can listen to, let's say, my podcast or your podcast. They can read books, they can learn about things, but it's then, well, how do you put it together for that individual? And I'll be honest, one of the things I love, yes, I love that these clinicians, go on and then they help their patients or their clients. I also love that the feedback we get is that they figured out how to sort their own health out as well.
There's a lot of that, isn't there?
Yeah, they're like, I did the symptom web on myself and now my joint pain's gone or my mood is better. And in some ways, I actually think that's super important to do it on yourself because once you see the power, you're kind of sort of really invested.
Yeah.
Do you know what I mean? I mean, what are your reflections on that?
Oh, yeah, completely. I mean, I think you and I are sort of living proof of that in some way. But it's the most powerful thing, isn't it? Where if you've experienced something yourself and you can feel that it works, and part of it is what I was saying earlier on, is that although all the studies that we sort of present and all of the science is evidence-based, actually what this framework is, there's no sort of, although we are in the new product, actually we're collecting data, aren't we, which will show that it works, I guess.
Yeah.
But yeah, it's a magic moment when they sort of think, hang on, it actually works. I've just actually tried these things, and one of the things. Again, one of the things that we teach is how to get that info out, and this thing about understanding what someone's typical day is like is really important, isn't it? And often there's not a week that goes by that I don't do this clinically. In terms of consulting, I'll often say, "Tell me about your typical day," because then you'll get a really good snapshot of that person's life. They might eat all their meals standing up. Well, no wonder you've got heartburn. That sort of thing.
As I'm hearing that, Aim, because I'm conscious that not everyone who listens to the show, but I say not everyone, the majority of people who listen are not healthcare professionals.
Sure.
But I think it's a really key point there, which is, what is a typical day like for you? Now, yeah, we can ask our patient that to try and build up a snapshot, but like everyone who's listening to this right now could try that exercise on themselves, couldn't they?
Yeah.
Like they could try and honestly go, not like your best day where you're living your best life, but what is a typical Tuesday like, right?
Yeah.
How does it roll? And actually, I don't know what you'd say. I'd say write it down, right? Instead of just going in your head, I sort of like get ready, have my breakfast, I drop the kids at school. No. I think people should write it down and go, okay, step by step, what do? I wake up. Every little piece, what do I do? How do you eat? Are you standing up? Are you rushing around? Are you having your toast in the car whilst you're dropping the kid? Because people could sort of do it to themselves, couldn't they?
And you have to sort of watch yourself from the outside almost. It's quite. Do you know what I mean? You can't when you're.
It's kind of journaling, right? That's what journaling is. It's like you stepping outside your life and looking in on it. Well, that's one aspect of it. It's kind of, you could journal your own typical. I like that. I hope people do that.
Yeah, it's funny. Something random happened this morning, which is only the second time it's happened to me in the last 20 years, I think. So I'm generally not an anxious person, I wouldn't say. So unlike some of my friends or family members, I'm not sort of hardwired to be anxious. I'm pretty laid back, and I was in a rush to get here, and so I rushed onto the train. I had to kind of run down the platform because I thought it said platform 4 and it was 14. So I went, Euston Station. It's quite so, and it was like, I don't know, 1 minute before it left or something. So my heart rate was quite up anyway. Went into this into the carriage, and I'd sort of asked when I booked the seats. I never actually sit in the booked seats normally, but I thought I would be able to do some work, and I wanted one of those table seats, with where your laptop plugs in and stuff. Anyway, I got there, and there was an elderly couple sat there, and I thought, well, I'll just leave them there. But the train was quite busy and really hot, and I suddenly thought, I feel really claustrophobic. I think I'm going to have a panic attack. And it happened once before, when in winter months where there's one train every 2 hours, and this was pre-COVID, we were sort of totally crammed in, and I remember thinking, oh my God, I can't breathe, that sort of feeling. I'm sure a lot of people relate to it. So what I'd done years ago is I'd learned how to do these exercises just because not because I need them particularly myself, but I can, tell other people about it. And one of them is this thing called anchoring, where you build a state. So say you sort of do a relaxation exercise for 5 minutes and you want to kind of mark it. You can pinch your earlobe like this. And if you do it every day for 5 minutes and keep pinching your earlobe at the end, after a while you can just pinch your earlobe and a swathe of calm comes over you. It's just like conditioning in some ways. So this morning I was thinking, how, because if you think too much about that feeling of your racing heart and the fact that you're feeling hot and bothered, you suddenly want to just get out. These people who go on flights and trains, and I don't get that. This is like the second time only the second time I've had it in, as I say, in 20 years. And I sort of thought, what can I do to get my vagal tone up really quickly? So I generally always carry a bottle of water. So drinking water does it. I pinched my earlobe. I suddenly slowed my breathing down, and I started sort of humming. It sounds ridiculous, this, but all 4 of those things increase your vagal tone, which is the nerve that kind of calms you down. It's the opposite of flight or flight. And within 30 or 40 seconds, I felt fine. That's not something that you teach on a course, but the point is the science about the vagus nerve is out there. Everyone knows what you have to do. And I guess, I do this 1 minute sort of meditation twice a day. When I get to work in the car, I do it before I go into work so that I'm ready for the day. And then I do it sort of in the driveway when I pull up at the end of the day, just so that I'm ready. You're not taking the doctor's bag into the house. And so I'm already slightly wired to be able to do those things. So it was very easy for me to do. But it's just an example of how, is that a lifestyle intervention? I don't know. But it's sort of, it's what I'm saying is there's lots of thinking behind it. But once you sort of start doing these things, they become second nature and easy. I'm not saying it's a cure for panic attacks. I'm just saying there are things that can be done.
It's a great example of many things. I think self-empowerment is one of them, which is, you've invested time in your life to understand what kind of tools you can take around with you in life in your back pocket, right? So what I love about those tools is that they didn't require you to have brought something with you in your backpack. Yes, okay, you have the water. Yeah. Okay, the water. But it wasn't so onerous that, let's say you didn't have the water there, right? Because a lot of these things are a threshold effects, aren't they? It's not that one thing in isolation is always going to do the job, but add 2 or 3 of them in together.
Exactly.
And you start to get that impact. And it would, depending on the level of stress and I guess agitation or anxiety, it will depend on how many interventions you need to use. But I love that pinching your ear, free, accessible, a breathwork practice, free, accessible. You happen to have water with you and humming, right? Well, that is lifestyle medicine, right? That is wellness. And I think it beautifully illustrates the art and science of medicine. But I guess expanding that further, the art and science of wellness.
Yeah, I think you're right. I was sort of thinking, what would I do if I saw someone having a panic attack? Because sometimes you sort of think, well, what would I do? As a doctor, what would I do if there was a person sitting next to me going through the same thing? And I think I would do the same for the. Sometimes I had someone come around to look at our house recently because bits are falling apart and it needs a bit of work. And I said to him, I want you to sort of think of this as sort of your house. Like, what would you do if, you had to, I don't know, fix this bit of wall or build a barbecue area, whatever it is. And it's the same. I'm very much like that with interventions, think something that's going to sort of almost help anyone, because all of those things, you're right, they're kind of free and they're, we know the science will sort of work. Why it works is different. So some people will drink the water and think, oh, my mouth's dry, and now my mouth's not dry. I wasn't thinking that, actually, but a lot of people having panic attacks would get, some relief from the water for that reason. But so it was just an interesting one because it happened today. I just thought I'd mention it.
Following that up then, so that would have been, I guess, 3 or 4 hours ago. We could almost plot out what might your morning have looked like had you not had access to those things. So, I don't know if you're up for that thought experiment, but let's say you weren't aware of humming, breathwork practice, pinching your ear and drinking water as a way of trying to manipulate your vagal tone.
The only other way out is to get off the train. I would literally have, because you're sort of, that you get something called hypervigilance, don't you, with panic, where the more you think about it, the worse it gets. And then you think, I've got to get off this plane or train or whatever. That's very common as well.
Ian, as we talk about the course, as you talk about what you did on the train this morning, like, it just brings up for me this other concept around lifestyle. I'm not sure lifestyle is always the best term, as you say, because it really, as you say, it's using your life as medicine.
Life medicine might be better moniker than lifestyle medicine, but yeah.
Yeah, it's something that I've discussed actually with Gareth, a videographer who's normally filming. He's never quite got the term lifestyle medicine. We've speak about it a lot. He goes, it's kind of like your life, really, isn't it, rather than lifestyle? And it's just interesting how we talk about these things. But, through the conventional lens of what lifestyle means to a lot of people, I would say people understand this concept that lifestyle can be prevention, right? If I look after myself, let's take these 4 pillars: food, movement, sleep, and relaxation. If I pay attention to those 4 areas, I'm going to hopefully reduce the likelihood that I'm going to get, a heart attack, Alzheimer's, even some forms of cancer, right? We know that our lifestyle plays a role in prevention. But what I've always tried to do in my public facing work, but also with patients, frankly, is really help people understand it ain't just prevention, right? It can also be treatment. When you have got symptoms, right? You can use the lifestyle as treatment, and you can also use it to reverse things. We mentioned evolving autoimmunity a few times, where we see people along that continuum where if we don't intervene, actually, if we don't help educate them in terms of how they can manipulate their lifestyle to influence their health, they might in 2 or 3 years end up with a more serious condition. And I kind of really still don't feel that is, even when I talk to doctors, I still think we're missing that piece, that it's not, oh yeah, prevention is better than cure. Prevention is better than, okay, sure, I don't disagree with that. Prevention is better than cure, but it ain't just prevention, right? Managing your stress levels better changes your biology. It changes your blood sugar levels. It changes your genetic expression. It changes how inflamed you are, right? So these kind of simple practices, breath work, humming, whatever, they change your biology.
Yeah, I mean, it's definitely shifted. If you look at every kind of guideline and every kind of, if you look at NICE guidance, for example, everything is always about earlier and earlier detection for things, whether it's, cognitive decline becoming a particular type of dementia, we must sort of screen for this and pick it up earlier. Great, but, what are we going to do about it? That's the conundrum, isn't it? Or, you've got altered bowel habit. Oh, well, NG12, whatever guidance says you need this test. But then often they come back normal, but the person's still got symptoms. And so it's a bit, the intention is right,
great.
It's brilliant, but that's going on at that end. But then there's this sort of, as I said, and you were saying bubbling up in terms of mental health, but in slow motion, there's this sort of growing army of people who are sort of becoming ill, as time goes on, sort of invisibly. And it's not to scare people at all, but there are sort of things, and I'm a moderate. I'm not someone who is perfect. I'm no angel. I as you know, I probably, I like a drink and, all that sort of stuff, but there's got to be some sort of counterbalance, But if, for example, I say I like a drink, but if there was something in my health that I thought, I really mustn't drink alcohol, because it makes the difference between me dying in a year and in 20 years, I'd give it up, and I think that's, do you know what I mean? There's a sort of, everyone's individual and everyone's got their reasons for why they do what they do. And I'm very aware of that. You can't just, habits are difficult to change, aren't they, as we know.
Sorry to interrupt. If you are enjoying this content, there's loads more just like it on my channel. So please do take a moment to press subscribe, hit the notification bell, and now back to the conversation. You mentioned habits. You said at the start of the conversation how work is really, really tough. Maybe about as tough as you've known it. You're saying that you've never seen it this bad with patients in terms of the general mental well-being of your practice population and I guess the wider population as a whole. On top of that, you've obviously had a very difficult year. Your dad died this year. How's that been for you?
Yeah, really, really tough. I mean, it was not really expected, and I think there are lots of things that go through my mind. He was 79, sort of not far off 80. Recently, it would have been my parents' 50th wedding anniversary, so it was sort of, it was one of those things. And Dad always used to kind of feel, rightly or wrongly, that his luck wasn't great, and he'd be sort of laughing now, thinking, "Oh, typical! I didn't make it to 80, and I didn't, sort of, this is just classic, what was written, sort of thing." And he was actually fairly well sort of person up until the point where he needed a knee replacement. Went in for this knee replacement, having mustered up the courage after like 10 years of almost needing it, and sort of walking around with this funny limp, but was cognitively really very well, and then suddenly came out of hospital and was delirious, which, if you don't know what delirium is, it's a bit like acute confusion, just getting up in the middle of the night, wandering around, not knowing where he was, and we didn't really know why, and it turned out that his blood sodium was low, and ultimately he actually had a lymphoma that hadn't been sort of picked up by anyone, and it didn't last more than 6 weeks, and sort of, and I think that's just the sort of the what, the very clinical what happened. But what's weird about grief, I think, nothing. I mean, we knew at one point, look, he probably wasn't going to come out of hospital, because the longer you're in hospital getting kind of inpatient care, the worse your outcomes are likely to be when you're that age, and you're sort of, and they don't really know what's going on, and it takes so much time with tests to find out what the underlying cause is for these things. And I've got lots of reflections on the grief. I guess the first thing is I was very lucky because I got to see him before he died, and all the stuff I wanted to sort of say to him, I was able to. And I know a lot of people don't get to do that because there's a sudden death, and you're far away, and you think, oh, I never got to say this or that. So
you were quite lucky with that, weren't you? Because you were away on holiday.
I was. It was the first time we dared to go away for over 2 years because of what's been going on in the world. And we only went to sort of Gibraltar because it was close, and I knew if anything happened, I could get back. But I'd been to see him a couple of days before we were going, and he was improving. So I thought, well, actually looks a lot better. But then a day into the holiday, he just totally crashed, which is like a medical term for just, became very ill suddenly. And I knew I had to come back. So then he only lasted a day after that. So we did the right thing coming back. It was very, very stressful. But, there's just so much to do, isn't there? I know you've been through this, but in terms of filling out forms and probate and telling people, you have to sort of ring all of his friends. And one of the things that sort of not annoyed me, but I found difficult was this, a lot of that we've got mutual uncles, haven't we? Sort of as in like, they're not sort of biological uncles, but they're kind of part of that Bengali community. They're all nice, very nice people. But two things really. One is a lot of people don't know what to say when someone's bereaved, and they're kind of looking for an out in the conversation because it's quite awkward. And the second one is this, oh, be strong for your mum, which I totally get what they mean because they've probably been through this themselves. But after a while I was thinking, well, hang on, what about me and my grief? If I'm going to constantly be strong for, there's an element of that. And also some people who I wasn't expecting to be that supportive, outside close friends were amazing. And then other people who I was expecting a bit more from were useless. And I think that's another common thing, because I say useless, I wasn't expecting, anything apart from just sort of a phone call or something. But I think it's fear of not knowing what to say. There's an element of that. And it's been weird. Nothing prepares you for it, And I know the thing is, a lot of people thinking, oh, this, well, it's your dad and he was old and he passed away. What's the big deal? But when it's the only sort of grief you've experienced, that's your experience. I can't imagine what it's like losing a child or or a sort of a sudden death that's unexpected. At least this was sort of, we knew it was coming, but it's tough. It's much harder than I thought it would be.
Is this your first, like not as a doctor, but on a personal level, is this your first real experience of grief?
Yes, it is. I mean, as a doctor, I've sort of helped be there for patients when they've been through it, but never experienced it. And so you're kind of trying to empathise. And what I never used to get was occasionally my mum or and some of my patients as well would get very, very sad many years after losing their loved one. Do you know what I mean by this? And not because it was the anniversary or anything, but they'd suddenly get a thought about dad or mum or the person they'd lost and become very sad. And when I was much younger, I never used to get that, going, well, I'm like, mum, it was 20 years ago since, Nana died or whatever, her dad died. And she'd be like, oh no, I'm just feeling very sad. I'm really missing him. And I didn't quite, do you know what I mean? When you're immature, you don't quite understand why that's the case. But it's the finality of it and the permanence where you suddenly think, you take these things for granted, like, oh, dad will sort that out or dad will know this. And you can't just suddenly ring them. I think on the flip side, there's something about, I don't know whether you feel this, but I sort of feel that, dad's kind of always with me now, and I don't have to kind of worry about him, getting old or whatever. And in a way, I think about him more now that he's not around.
Yeah. It's interesting. You mentioned that a lot of people were looking for a way out of the conversation, because there is this general discomfort. I remember chatting to Julia Samuel, this amazing psychotherapist who came on the show, I think in September 2020, so almost a year and a half ago. We had a great conversation. But towards the end of it, we were chatting about death. And we were talking about the language that we use around death and how often we soften our language to just sort of remove ourselves from it, like you have lost someone. And Julia was very clear that she thinks that's problematic because it keeps a distance between us and what's actually happened. It's not allowing us to confront it and really deal with it. And since that conversation, I've been very intentional about not using that term, you've lost someone. So I didn't say to you, you lost your dad this year, which is how I might have said it.
Like he's gone missing at Brent Cross or something. I don't.
Exactly, right? I said, your dad died this year because that's what happened.
Yeah. And it's a fact, yeah.
It's a fact, and I think we do this a lot, don't we? And I think there is a discomfort. And one thing you said to me, I called you pretty regularly, I think in the immediate month or so. And I remember you once were reflecting to me and you said, you said something to this effect that I'm kind of getting the feeling that you don't really grow up until you lose a parent. Was that what you said? Maybe you could clarify what it was and what exactly do you mean by that?
Yeah, I know exactly when you mean and what you mean. And what it was, I think it was, we'd spent a lot of time in the family home, which was sort of in the process of selling now. But and I was looking through lots of old stuff, and I remember thinking, God, it's like sort of getting rid of my childhood. This is, I've spent, I think my parents were in that house for 38 years, and I suddenly realised it wasn't really the objects so much. It was more that, losing a parent is like the final piece of becoming a proper grown-up, I think, is what I probably would have said to you. That feeling of, right, the buck stops with me now. It's like, in terms of being not like a family representative in an old-fashioned way, but it's like there's no one sort of higher up to kind of ask, or, it's like, oh, is it okay? And suddenly decision-making and all of those things fall to you.
Of course, everyone's experience of death is different, right? So everyone's got the right to view it the way they want to see it. But I've thought a lot about that since you said it. And whilst I don't know if it's true for everyone, of course, I really do think there's something to that. For some of us, I don't think we do grow up until we've lost a parent. That was definitely true for me. Suddenly it's like, okay, it's you now. It's not, and I don't think I was even intentionally or unintentionally living in dad's shadow. I really don't think it was that. I don't think it's as linear as that. There's just something about it where, as you say, the buck now stops with you. Do you know what I mean?
Yeah.
Do you still feel that way now, a few months on from saying that?
Yeah, I do. I think it's what's even more ridiculous is I'm very conscious of that being a thing, and I do feel that. But you know, I don't think I've actually had that much time to grieve. It's just been such a relentless year, and we've just not stopped. And so, you know, I've got a bit of time off coming up, and I think it might sort of hit me. I'm not even sure it's really hit me. I haven't been able to chew it down. I haven't had any sort of bereavement counselling, all the things I would suggest to patients. But I've had a lot of great support, you know, from yourself and other friends and family. So, you know, and, you know, I hate these cliches, but you sort of sometimes, Dad wasn't very sentimental, and so a lot of the other funny thing is, I'm sure you get this as well, I sort of know exactly what my dad would say if he were here, for example, and that's quite nice. You know, you can predict almost what, you know, and that's what I mean, they're always with you, you know what I mean? It's like, yeah, I know what, you know, oh, I need some advice. What would Dad say, and what would Dad do? There's an element of that, and so yeah, I haven't really taken stock of it. I think we've kept going. There've been lots of other things to do, like, you know, moving, you know.
Well, that kind of speaks to something you said earlier, which is that often it blows up a few years later. People suddenly experience real grief later. Now, there's many reasons for that. One of the reasons, in my experience, is that it wasn't fully processed. And life got in the way. As you're saying, you are a busy NHS GP. You've got 2 young kids. You know, your wife works. You've gone back into work, and I know what your work days look like. They're pretty insane. We need time to grieve. We need time, you know, even beyond grief, right? We need time to understand our emotions. I honestly feel this is one of the biggest well-being problems with people these days, is the ease with which we can distract ourselves. So therefore, because we can distract ourselves, we do, and therefore we don't lean into the pain, we don't sit with the pain, we don't understand what that pain is trying to tell us, because it's much easier to have a beer, glass of wine, you know, spend a couple of hours scrolling. And I say that with no judgment and criticism at all. I get the temptation. Do you think your experience this year has made you better able to counsel patients who are dealing with grief?
I think possibly in the way that all the things I've just mentioned now, in terms of my own feelings, you can now preempt and kind of understand when someone goes, well, you know, my brother's being really difficult, or my sister's just not talking to me, because those sort of things happen as well, because it's very stressful, you know, very stressful for everyone, and everyone's processing things differently. And there are going to be potentially in families arguments, and, you know, just about arrangements and who's doing what, and although we never had any of that, but I think, you know, being able to just say, oh, you know, hey, you know, some people just don't know how to deal with grief, don't worry, just because your best friend hasn't rung, you know, that sort of thing gives them some context. So I think I'm no grief counsellor, and you know, I'm not qualified to do that, but I think just being supportive and compassionate and just listening, sometimes you need an extra, you know, someone outside of that immediate family to just be able to let off steam to. So yeah, I think I'd like to think so. Yeah,
I think that's one of our main roles as healthcare professionals, actually, in terms of certainly in primary care and general practice. I think being able to be a good listener with your words, but with your body language as well, I think it's one of the most powerful forms of medicine we can give people, because often they don't have it in their own life. And often there's too much baggage and history with immediate family to have that kind of non-judgmental listening. And I think this is, again, something that we do touch on in our course, but it's something I didn't learn at medical school. I have learnt, I'm interested in your reflections on this, but I have learned that me being able to listen with compassion, with empathy, without judgment, is medicine in and of itself. Sometimes that is all you need to do. And someone can almost use you as their sounding board that's not sort of pushing back at them, but they kind of process what's going on just because we provided the space for that. I don't know, what's your perspective on that?
Yeah, I really do. I mean, recently one of my ex-partners who's retired, we were meant to be having his retirement party just before COVID lockdown 1 hit.
Yeah.
And now, sort of 2 years later, we only got around to having it quite recently when things unlocked a bit. And so it's long overdue. And he was a GP cut from this cloth, exactly what you're talking about. And I would say I am as well. But what Mark was very good at doing is that his patients, a lot of his patients just, you could say they were dependent on him, but he was just very, very, very good. And I sat in with him. I remember when I first started at the practice for a week or two, and often he wouldn't say anything. He would literally just sit there and kind of nod, but in a very kind way. And I remember making a speech at his retirement, just off the cuff, going, there's lots of different types of doctors in this room. There's some that are good at managing people. There are some that are good at ticking boxes. But Mark's the kind of doctor that changes people's lives. And he did. If you listen to the kind of stories that his patients tell you, they'll go, yeah, I couldn't have got through the last, 25 years without him. But if you're looking very clinically at well, hang on a minute. If you're using the lens that unfortunately now modern medicine has to, because we're so busy, that kind of medicine's been totally eroded. We don't get the time to do that. It's really sad. Yeah. And some patients do need that continuity because you keep them going and often they'll have enormous amounts of trauma in their life story, which is why they need compassion. And actually the medical model doesn't work. It's like, well, and the problem with now that we're having, I think, in general practice is because there aren't enough GPs, they're carving out bits of our work, going, oh, we'll chuck a physio in and a pharmacist, who are all great. That's brilliant. But people don't sort of work in bits. You need someone to kind of, do you know what I mean?
Yeah,
but a lot of doctors do think that's the way that it works. It's like, well, you can just, mental health, just book them straight in with the mental health person. That's fine. But if it's someone that I've known for 10 years, it's much better that I may not be as good at mental health as that particular practitioner, but that's not the point. I know their whole story, how they tick. There's this trust that builds up.
We're not just this kind of robot with all these different parts that we can just, mental health, let's just put that part in there to get tuned up and then put it back into the hole. And I think that's what we like to think we offer as GPs.
It's whole person care, isn't it?
Whole person care, yeah. Exactly. You say that's the way modern medicine needs to go, or has needed to go because it's so busy. I don't think we need to go that way. I think there have been pressures that have put us down that way, but I don't think we needed to. And actually, I think if we do a cold, hard assessment of how well it's working, it's just not working for so many chronic, low-grade sort of lifestyle and environment driven problems. It just doesn't work. And I guess that's the kind of doctor who, when an external source comes to monitor, what's going on, what have they done, how many boxes have they ticked, it's like, well, that stuff isn't showing up as well on those parameters. But in terms of what he's doing for patients, it's like that phrase, isn't it, that not everything that matters can be measured, and not everything that we measure matters.
Yeah, absolutely. That sums it up, I think. And you're quite right. And there's lots of research on this as well, in terms of, compassionate inquiry, compassionate listening, active listening, all of those things. And something that springs to mind is the work of Milton Erickson, who was a sort of a doctor and a hypnotherapist, and as well. And he looked at lots of recordings of doctors and patients, and found these patterns, and found that doctors who talked down to patients generally had worse outcomes, and the doctor-patient relationship wouldn't work. Whereas if the doctors who listened and were compassionate, their patients had better outcomes. They were less likely to complain, and it makes sense.
We talk about it as a doctor-patient relationship, but it goes beyond that, because what is a doctor-patient relationship? It's a relationship.
Yeah, exactly. Yeah,
Right?
I know
So
it's just been labelled as
it's labelled a certain way, but think about an interaction you or I might have with our wives, right? Well, does it go well if someone's talking down to someone? Well, no, clearly not. Does it go well if someone's not actively listening and trying to butt in and give their opinion? Kind of no. So yes, there's something unique about it in one level, but then you could argue that all relationships are unique. It's about fundamentally being a compassionate human being who's sensitive to the needs of people around you. And I guess if you can do it in your consultation, hopefully you can do it outside your consultation in all aspects of life. Of course, it's not always that easy, is it? Because we can get triggered by the people closest to us. Do you know what I mean? It's just a relationship, isn't it?
It is. Yeah, absolutely. I think that's the hard thing with that. One of the things years ago that I realised is, how sometimes it's very easy to say, oh, so-and-so is really irritating, it's an easy thing to think. And one of the things, that, I'm writing a little bit about is how, your habits become you, don't they? And what I mean by so-and-so is really irritating is that the things that person is doing, their behaviours are actually irritating. It's not them. And the way I sort of myself kind of manage that is I try and look at people's behaviours rather than thinking it's them. Otherwise, anytime anyone does anything, you think, oh, well, they're an idiot or they're whatever. And it's not actually them. It's that their behaviour is there for a reason. And if you look at the behaviour and separate it from the person, you can handle it a lot better. I find that as a doctor as well as just a human being.
Tell us a little bit more about the book. I'm so excited you've got this book deal.
Oh, thank you, mate. Yeah.
I think, the articles you've written in the press, the mainstream press for years, I think are very well written, I think you're a very stylish writer.
Oh, thank you.
So I, for one, can't wait for it, but it's not out for a long time, is it?
No, that's right. It's out in January 23, and essentially the book it's on health and well-being. I'm not going to give the title away, but it's got in it kind of, a lot of the stuff we've just talked about today, but kind of what we try and teach and what your books try and kind of educate the population about, if that's the right phrase. But essentially, rather than just teaching doctors and healthcare practitioners, there should be a way of taking charge of your health and laying all these things out, and almost in a sort of a programmatic way, thinking, wait a second, I need some knowledge, but I also need to know what I'm about, what makes me tick, and how I can fix myself.
Yeah.
Partly because, that kind of medicine and those sort of symptoms, health services that in this country are available for free are buckling. That sort of empowerment that you want as an individual to be able to be more in control of your health, but also understanding certain nuances that I think you and I know that on our course, a lot of our colleagues, it's not because we're any cleverer, we've just sort of done more reading or whatever, but these little sort of elegant tools that just work very quickly. Yeah. It's not, I wouldn't call it health hacks exactly, but they're sort of things that are totally based on evidence and science that works, but people just may not see it in that way. Yeah. Just like some of the concepts in your books, I think it's got a lot of that type of writing in it, and I'm I've got to write it. Actually, I'm sort of nervous. I'm not going to be able to submit it in time, but yeah, I'm so excited because it's almost like my, I don't want to sort of big myself up, but my kind of, in my head, my kind of clinical wisdom put in pages in a book.
I think it'll be incredibly valuable because, so many patients want to see you. There's always a long wait because of your manner, but also because of, I think, these little clinical pearls, these practical tips that you have accumulated. By the time the book comes out, it'll be 25 years of practice pretty much for you. That's tens of thousands of patients that you've seen in very challenging conditions, in short consultations, in pressured consultations. So, you have to figure out very quickly what works, don't you, for real patients in real life with busy lives, right? How can you give them tools that they can access and make them better? So I think it's going to be great. I've enjoyed our conversation. I didn't quite know where it was going to go today.
No, we never do. We never do.
And we'll definitely talk again on the podcast.
Yeah, I'd love
excited
to.
about the book. Good luck with the writing process.
Thank you.
Just to finish off, podcast is called Feel Better, Live More. When we feel better in ourselves, we get more out of life. Given what you're seeing day to day in your job as a medical doctor, I wonder if you could just share at the end some of your sort of final thoughts or tips for people who are struggling right now.
Yeah. I think it's fair to say that everyone is struggling more than they were, and the world is very uncertain, and people that like certainty are the ones that are struggling the most, I would guess. And things like anxiety and depression come from that place of uncertainty. Particularly if you're someone who's a perfectionist or someone who is able to keep on top of lots of things. Those things are not possible in this day and age. And so my sort of one piece of advice, and what I try and do myself, is just to live in the moment. Because at the moment, that is all we can do. And if you kind of live from moment to moment to moment, what you'll find is that the background environment and the background interference of how doom and gloom things are just won't get to you. Just savor the moment. If you're sipping coffee, really taste it. If you're talking to someone, really look in their eyes and try and clock the color of their eyes. When you're listening, try and listen to the timbre of what you're listening to. Be in the moment as much as you can, and that way you'll get the most out of life.
Great advice. Really helpful. Thanks for coming up on the train. Thanks for coming to the studio. And I'll see you soon, mate.
Yeah, see you soon. It's been a pleasure. Thank you, mate.
If you enjoyed that conversation with a real-life working medical doctor, I think you are really going to enjoy this one. That's all about the main causes of inflammation and what you can do to prevent it.
I think when you talk about the immune system, you almost have to step back and look at what is going on and the effects of inflammation.